She's a sweetheart. I don't know what the community would do without her. I can tell you a story about my father. If I get sentimental, is that okay? Passed away from cancer, and Cheryl just lived around the corner from them, and she was there for everything I needed her for. You phoned her, she was there. My dad fell in the bathtub, she was there. We couldn't get him out. She helped us get him out. Medication and stuff, she was great. I was a little afraid to fill his needles. She was there, she filled them all, and all I had to do was give them to him. If it wasn't for Cheryl, just someone to talk to in the community too. She's an excellent, excellent person.
Madeira Park's my hometown. I was 5 when we moved here, so I've been here for 50 plus years. I'm not going to go any numbers than that. It's a small town, but it's very passionate. I mean, everybody knows each other and we care for each other, and that's the whole thing. Whether you know your neighbor or not, you're still going to go and help if they asked for it. It's just what we do in small town BC.
With Cheryl, it's more in the elderly patients with chronic comorbidities that have either the potential to fall through the cracks in the healthcare system, or patients that, you know what, we need some extra eyes, we need some extra support, especially in collaborative healthcare.
So we're going to see a client. His name's Ab. He's a chronic COPD patient, and he just had a short stint in the hospital, actually about 12 hours. So we're just going to go up and take a set of vitals and check on him and see if he needs anything else from us today.
We have a lot of people in the community who it's been 10, 20 years since they've seen a physician or a nurse or anything, and she can put the initial eyes on them, and then we can go from there. And she's a good fit to get in the door.
We realized that Ab was having some difficulty at home. His wife is his sole caregiver. So I met with the nurses at our local clinic and made kind of a care plan to start visiting him more regularly, educating him on his medications. One of his confusions is, why do I take these medications? Hello. Oh, Wendy, you are home. Good. Lost behind the curtain. How's your heart rate been today? Has it been okay, or is it all over the map? You get short of breath, right? Yeah. Okay. Okay. I hear exactly what you mean now.
And he's on hydromorphine now to replace the
gabapentin, right?
Yeah. No, that's to replace the Tylenol 3.
Oh, okay, good.
She cares, and she makes him do stuff that he has such mobility problems. He won't listen to me where he might listen to her, and I think that's important.
It's quite obvious what they're doing with me. You multiply that by how many other people are helping.
I know he appreciates it, but I appreciate it more than he does.
It's really important to have a conversation with somebody on the phone. They can tell you anything they want, but when I visualize somebody, I can see the difference, the shortness of breath, the scared looks in their eyes, like, what's wrong with me, help me, but they don't want to say the words. And supporting the family that's their caregivers. Today was a prime example. Caregivers, they get burnout, and with them not being there to be able to care for that patient, where do they end up? They end up in the hospital and the caregiver right behind them, or usually before them, because they get burnt out so fast. So it's to assist them too, not just the patient, it's the family dynamic to keep everyone safe at home and healthy at home, hopefully. That's the outcome, the final outcome.